Hello, I'm Younghee. Today, my thoughts are with the citizens of Korea. 평화 위로를 당신에게 보냅니다. I'm going to talk about complex post-traumatic stress disorder, or C-PTSD. This is a mental health condition that can develop over years of prolonged trauma. It's different from regular PTSD, which is a common occurrence in military veterans and emergency first responders. C-PTSD can be caused by the repetition of mental, physical, and/or sexual childhood abuse, neglect and emotional deprivation, gaslighting, which means manipulating someone into questioning his or her reality, living under the fear of threats, violence, intimidation, and the destruction of a person's self-esteem for a protracted amount of time. Victims who experience trafficking, getting taken as hostages, surviving war, being subjected to domestic violence, and those who have been adopted, especially transracially and transculturally, are at heightened risk. C-PTSD is called complex because it affects so many areas of an adoptee's life. Everything from trust, relationships, attachment, self-esteem, self-care, mental health issues, physical health issues, emotional and identity disturbances, and hypervigilance, which we've discussed before, as well as memory and dissociation issues. Keep in mind that adoption takes place when a person is just an infant or a toddler. The hope is that such a young child won't remember his or her past. When done intentionally, this is abuse, trying to eradicate or suppress someone's identity and earliest connections. This is all compounded by the fact that a child is pre-verbal. This means he or she is unable to express fear or confusion about what is happening to and around him or her. This child cannot put into words the feelings he or she is experiencing, and most of all, cannot ask for and receive help in response. This leads to a sense of powerlessness. C-PTSD causes terrible scars on the psyche. Even happily adopted children are exposed to some trauma, but they often bury these memories as a survival tactic, which ensures that a loss coming out of nowhere does not happen again. There is help out there, but it can take years and more often permanently changes an adoptee for the rest of his or her life. It's extremely difficult to find an effective therapist, not to mention expensive, even with health insurance. As adoptive parents, do not make your child's upbringing or adult life more traumatic. Be a compassionate, stable adult. Thank you for listening. Be well.